Hi guys, my name is Dr. Haroon. I am a cosmetic doctor who specializes in non-surgical aesthetic treatments. In today's video, we'll be discussing the differences between Botox, dermal filler, and skin boosters. I'll be talking about what they are, how they work, and who might benefit from these treatments. Let's start with Botox. Now, most people have at least heard of Botox, but what I want to do today is clarify exactly what it is and why people get it. Botox is a muscle relaxant. If this is the muscle and this is the nerve, Botox will sit right in the middle and stop the nerve from working against the muscle. When injected in certain areas of the face, it can soften and minimize the appearance of lines and wrinkles. The most common areas that it's used are the vertical frown lines, the horizontal forehead lines, and the lines that form either side of the eyes, called the crow's feet. Other cosmetic uses of Botox can include an eyebrow lift, improving the appearance of a gummy smile, lifting the corners of the mouth, and slimming the face from the front. But Botox isn't only used for cosmetic reasons. It's also used to help treat medical conditions, such as improving the symptoms of teeth grinding, a medical condition known as bruxism. It can decrease the severity and frequency of migraines, and it can also be used to treat excessive sweating. Any procedure involving the use of Botox will have to be administered using a very small needle. This does pinch a little bit, but most people find the procedure very bearable, and it only takes a few minutes from start till finish. It takes a few days for you to start to see any difference at all, but the final result can usually be seen around 2 weeks. And the results, they typically last for around 3 to 4 months. Moving on to dermal filler. So what is dermal filler? It's an injectable gel which is made up of hyaluronic acid, which is a naturally occurring substance in the skin and tissues of our bodies. This gel comes in different thicknesses depending on where we are using it and what the desired outcome is. This gel will be carefully placed under the skin using a small needle or a cosmetic cannula, which is a thin, blunt, hollow metal tube. Some of the most common areas of treatment are the cheeks to add volume and contour, the lips to add definition and subtle volume, the under eye area to improve the hollowness and shadowing, the nose to minimize the appearance of a bump or to lift the tip of the nose, the jawline to add definition and to give a sharper looking jawline, the chin to make it look more V-shaped or to balance someone's profile from the side, and this gel can also be used to soften the appearance of smile lines and marionette lines. Dermal filler can be used effectively in many other areas, but these are some of the most popular treatment areas. The cosmetic results typically last anywhere between 6 to 12 months, depending on the area that is being treated and the type of dermal filler that is being used. And lastly, what is a skin booster? There are many different types of skin boosters that come in many different forms, but the purpose of all of them is to improve the overall quality of the skin. Similar to dermal fillers, most of the skin boosters come in a gel form. They contain hyaluronic acid and they are also injected under the skin. The main difference is that skin boosters do not volumize, contour, or define. They simply improve the overall quality of the skin. One of the most popular skin boosters, and the one that I use most frequently, is Profilo. This is a gel that's injected under the skin at specific points using a fine needle. On the day of the treatment, you'll be able to see the small bumps under the skin, and they usually disappear within the next few days. Profilo is always given as a course of 2 or 3 sessions, 4 to 6 weeks apart. And the results typically last around 4 to 6 months when most people decide to come back and repeat the course. There is a commitment required when carrying out skin booster treatments, and repeat sessions are usually needed to yield the best results. Most people will see the benefits after the 2nd or the 3rd session. Some of the benefits include better hydrated skin, the skin looking and feeling tighter, and an improvement in fine lines and wrinkles. This treatment is not isolated to the face and can be used in several other areas. Some of the popular areas include the neck, the back of the hands, the décolletage area, the back of the arms, and also on the thighs. The skin booster works the same in these areas and will improve the overall quality of the skin and improve the appearance of crepey, dry and loose skin. So that was a quick tour of Botox, dermal fillers and skin boosters and some of the main differences between these treatments. If you're asking yourself what treatments you might benefit from, it's difficult for me to say without carrying out a detailed consultation and facial assessment. But generally, if you're looking to improve the lines and wrinkles around the eyes and on the forehead, Botox is generally the best treatment. If you're looking to volumize or add definition or enhance the shape of facial features, dermal fillers are usually the best option. And if you're simply looking to improve the overall quality of your skin, then skin boosters will usually be the best option. This is a rough guide and you should always have a detailed consultation with a medical practitioner before going ahead with any treatment. I hope you found this video helpful, and if you have any questions regarding these treatments or any other treatments that we offer, please get into touch. Thank you guys. Bye.